Welcome. So today we're at our Applied Practice Experience virtual student highlight event. So we do these fall, spring, and summer. And it's an opportunity for us to highlight some of our student speakers, their presenters who are finishing up or have finished up their Applied Practice Experience, also known as an internship. You'll hear those two terms used interchangeably today. So Applied Practice Experience, same thing as an internship. So our fancy accrediting body tells us what to call it. So we really appreciate all of you joining today. I see we have faculty in the audience, we have current students, we have family. So we're so excited for the folks who have joined us today. This is going to be recorded. We will post it on the website. So if you have to sneak out early, you don't get a chance to engage fully, the recording will be available for everybody so you can pop back in and watch it. And so we're going to go ahead and get started. I don't see Lynn here with us yet today.
She's joining right now.
Okay, great. So she usually likes to start us off with a couple of different reminders. For those of you who may not be as familiar with the Zoom space, we will use the question function, so the chat function, I'm sorry, if you have questions, but you're also welcome to raise your hand when you have questions. I will sort of facilitate the panel to begin with, and then at the end of that facilitation, we'll have open questions from the audience. So again, you can use your chat, raise your hand. And I see Lynn has joined, and so I'm going to pass it to her.
Good afternoon. I apologize for being tardy. I have Zoom issues. I don't know, doesn't like me. But anyway, good afternoon and welcome everyone. My name is Lynn Duran and I'm the Assistant Dean for Student Affairs at the College of Public Health. Thank you so much for joining the virtual MPH Applied Practical Conference student highlight event. We're so excited to have you all with us today, including some of our current students, faculty, preceptors, and prospective students. We would like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous people. Today, Arizona is home to 22 federally recognized tribes, with Tucson being the home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. As you may know, our Master of Public Health students from Tucson, Phoenix, and online and global MPH programs conduct applied practice experiences in communities around the world. The Applied Practice Experience serves as an integral part of the MPH degree curriculum, in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. These hands-on, culminating experiences benefit students and organizations alike. We are so profoundly grateful for the collaborations between our students, faculty, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual Applied Practice Experience Conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from some of our MPH presenters and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view our fantastic student presentations. Kim?
Yes, thank you for the welcome, Lynn. We're so happy to have everyone here today. So hi all, my name is Kim Barnes. I'm the Director of Student Affairs for our Phoenix campus, although I work with students on both Phoenix and Tucson campuses. And we're very happy to welcome our student panelists today. So today we have Brianne Cartagena and Madelyn Hardy representing our Tucson campus and our online campus respectively. You can learn more about their presentations, again, are on our open website, which we'll share at the end of the session. So make sure you watch their full presentations because we're going to dive right in. Brianne and Madelyn, first question, you could each briefly introduce yourself and describe your applied practice experience, kind of get us centered for the day. We'll start with Brianne because that's alphabetical for me.
So hi, my name's Brianne Cartagena, and I'm getting my MPH in epidemiology. I'll be graduating this upcoming December, and my MPH APE was through the University of Arizona with the student transformative experiences to progress undergraduate and graduate professionals, which is also known as the Step Up program, and it was through the Cancer Center. So with the goal of the Step Up program, it's to provide research experience in cancer control and prevention. Specifically, what I did was I focused on examining environmental factors such as noise levels, PM 2.5 concentrations, ozone levels, temperature, cancer trends, and tree coverage within Tucson boundaries. So I wanted to advance the understanding of how historical racist covenants, which are policies that restricted property ownership based on race, might contribute to ongoing environmental health inequalities in Tucson. So what I did was I analyzed data related to environmental exposures, and my research aims to highlight the significance of these factors in addressing racial inequalities in public health in urban planning.
And Madeline?
Hello, my name's Madeline. I am also graduating this December with my MPH, but my concentration is in health services administration. And my internship was working with the Northeast Tri-County Health District, which is based in Washington State, and they serve the 3 northeastern-most counties of the state to establish a medical reserve corps. So that is a group of medically licensed volunteers that can be deployed during different public health emergencies or community health events to help alleviate surge capacity and just help in response. And the goal of that is to improve a rural area's emergency response capabilities.
Thank you. So as you can see, that was the very short elevator speech version of what they go into lots more detail about what they did, how they did it, results, all of that on their presentation. So again, make sure you watch those after today's session if you haven't already. So starting first and foremost, students often want to know, and we also want to know, how did you find and secure your experience? Do you start us, Madeline?
Yeah, so I was already working with the health district in their community health department. I was working, or I still am working in overdose prevention and harm reduction. And so when it was time to find an internship, I went to my administrator and I asked if there were any projects I could take on. And initially I wanted to do a community health needs assessment, but they had actually just done that the year prior. So we kind of went over the results of that and saw what the most pressing needs in the 3 counties were. And emergency preparedness was one of those. So we went to the emergency preparedness directors in each of the counties and asked them what projects we could do that would help them. And they said that a medical reserve corps was something that they've been trying to establish, but didn't have the time or the capabilities to take that on. So we decided to do that for them.
That's a really great example of a workplace experience. So it's where you work, but it is not what you do. And it's an area for growth. And so we always have those, and we love to see a really good example of that bridge, but something totally new. And as you talk about in your presentation, you learned a lot about emergency preparedness that you did not know. So that's a really great way to bridge that. Brianne, how did you find your Step Up experience?
So the first time I heard about Step Up was actually during my undergraduate career, but I missed the deadline. But I remember like learning what Step Up did, and I was like, oh, I'm actually like really interested in learning about like cancer prevention and control. So earlier last year, I was like walking into Health and Sciences Innovation Building and I was going into the elevator and there was like a flyer up for Step Up. So I like remembered what it was about and I took a picture of it and then I applied online. And then I also got an email from it with the College of Public Health listserv. It was on like one of the like towards the bottom of our weekly emails we get. And it said like, oh, apply to the Step Up program. And so I did.
Oh, so see, we need to make sure we let Step Up know that their flyers in buildings is an effective marketing approach. And we are so happy you also saw it in our newsletter. We do try to get those opportunities out. For those of you who are seeking opportunities, we just posted Step Up on the Hub. So I was super excited to see Brianne's information her experience was based with Step Up because it's a regular one we see and it's a really well-established program. So you two sort of have opposite ends of the spectrum, right? This well pre-established apply for summer experience and this build it yourself at your workplace type experience. And those are two really good examples of the ways in which our students are usually finding experiences. So that worked out, was not planned for you two to have that, but worked out really well for us to have those two different approaches. So can you describe any what you would consider, what you feel like were unique experiences you had during your applied practice experience, like something you had never dealt with before, or you felt was like noteworthy, like something you came home and said, oh my gosh, I had this crazy experience today. Was there anything like that at your experience? And either one of you can go if you have something to share.
I can start. I did have a few things for this question. One of my personal favorites is the different people that I got to meet in the emergency preparedness world. It was very like intelligent doomsday preppers is the best way I can put it. And it was really scary because they were informing me about all these disasters that I did not even know I needed to worry about, but also really reassuring that there are people out there that know how to act and respond in those situations, and I can become that person as well. I also got to travel to Seattle for the state MRC conference, and Washington State is trying to set up a statewide MRC. And so I got to see their warehouse basically of different supplies if the world ends in Washington and what they would do with that. And then I got to go to Chicago for NACCHO's National MRC Summit, and it was the first one that they were doing in 20 years. So that was really exciting. And then the different trainings that we've been researching for our volunteers, like wilderness first aid, psychological first aid, and stop the bleed trainings. It's really interesting to learn about those kind of responses.
I could not love more your description of intelligent doomsday preppers. That was so lovely. And I feel like people understand what you mean by that. And your presentation, I did, I take notes on them when I watch them, but I specifically wrote down your have a go bag, communications plan, and a home safety. And I thought, I don't have all of these. And so you got me with those ones. That was well done.
Yes, yeah, there was someone I met at the Seattle conference who's in the northwest corner of Washington. And he had this backpack with him, and he said he takes his backpack everywhere, and it has like ropes and flares and sodium fluoride if there's nuclear exposure and all these things. And I was like, I'm happy you're here, but I think you are a TSA's worst nightmare.
I'm certain. I'm certain. Yeah, but a good person to travel with. Let them deal with it and then be on the receiving end. Brianne,
Yes.
What about you? Any unique experiences you felt like you had that you maybe shared with other people and could share with us today?
Yeah, so with the Step Up program, it was kind of mixed between like a majority was like our own research that we did, but we also had on top of like didactics that was specifically like incorporated with the program itself. So we did journal clubs where we had to read like a specific cancer prevention control article, and then we would talk about it in like not class, but like in our group sessions with like the other Step Up program students. So I didn't realize this, but as master's students, we were the ones who had to like lead these discussions, which being in a master's program with just like constantly other master's students, and also we usually have PhD students in our courses. It's more so like the PhD students would kind of like run things or like have that like leadership role. So I feel like that was like a pretty unique experience where it was me as like the master's students, and then like the other people in the group were undergraduate students. So I had to like make the presentation and come up with the questions to make it more of like a collaborative experience with all of us. And then we also did a lot of community outreach, which I didn't know that we also did. So we got to work with the food and pantry on campus. And then we also got to work with the Students Are Sun Safe program. So I really enjoyed doing that. We got to make like flyers, and we also went out into the community itself. So there was different, like a back to school bash we did, and we would like sit there and pass out like sunscreen and give like informational pamphlets on like the importance of sun safety. And then a unique experience with that is when you're doing community outreach, you kind of are being or you're talking with a bunch of people with a bunch of different viewpoints. So we would have some people that kind of were just like, oh, like sunscreen's bad for you. And they would like come and talk with us. So we kind of had to just like not be super like political in regards to it, but just kind of just be like, like, but there are these benefits of it. So like kind of like at the end of the day, you do really need to use it because it does like prove like scientifically in research how like much it improves um the impact of like too much sun exposure, especially here in Tucson.
Yeah, what I loved learning about in your presentation were some of those things you just mentioned, because I had an image of Step Up as really the individual research part of it, and not all of the other elements. And I think what makes it such a great program, I'm even learning, is that it is very well-rounded, right? You do have these discussions. It's a full engagement experience, right? And that you're right, outreach is it's challenging because the people you actually want to get the information to are the people that are sometimes the hardest to communicate with, because they either have different opinions or they absolutely don't know, have the information at all, or not receptive to hearing that. So you don't know, it's not like it's a person it's somebody on the street, and you have to figure out where they are and meet them there and have that conversation. So it sounds like you were learning a lot of the elements of, and you described this, you talked about your public health researcher skills. So beyond the actual skills of data analyses and GIS mapping, sort of how to be a public health practitioner, which I think it's amazing that that program is built and that these experiences allow students to kind of embrace that and really become that. So it was excellent to see. So if you both could, this is where I think the faculty like to hear some of this stuff, but if you could briefly explain the skills or knowledge from your MPH curriculum that you felt you most utilized during your experience. So what did you feel like you were already bringing in to the experience from having learned it in the MPH?
I can start us off. So with the EPI department, we did a couple of different courses that our professor would have us do community outreach and education. So I was able to have that sort of experience. Specifically, mine was with One Health. So we were able to go out into the community, specifically with the Pima Animal Care Center, and we would work with like the faculty there and also the animals there. So I brought that with me while going into doing community outreach with Step Up. Um, and then another major one was with GIS mapping and utilizing like statistical software. Biostatistics was a major one that definitely helped, even though personally from my experience, I learned a completely new statistical analysis software, but I was able to like take what I remember from like undergraduate and like beginning of biostats, first year MPH, and then build off of that within the program itself. So having that sort of curriculum and background definitely like helped me be successful in the program.
It helps you feel just a little bit more secure in starting a new experience. Like, okay, I've got some foundation that I can work from. I don't feel like I'm totally new to this. I think that's always really helpful. Madelyn, what about you?
Yeah, the class that really stood out for me in terms of like how I applied everything that I learned was the public health policy and management class. They taught us how to do strategic planning, which part of the application process to be nationally recognized as a MRC unit is to create that strategic plan of how are you setting this up? How are you operating it? So that was really helpful. Principles of program planning, development, budgeting, management, evaluating the community initiatives. Also, the health services administration course was really good for delivering health services, especially in a rural area. You kind of have to get creative with how you manage your resources and how you advertise things. And then also public health law and ethics. There were a lot of like RCWs, which is Washington laws, basically, that I have to make sure that the volunteers are covered with liability if something happens. And yeah.
Yeah, you were talking about earlier, you covered all your competencies. Like you could, all the HSAs building it. And I think that that's really telling that you found and designed a project that was directly related to what you were studying, which is ideal, right? So that's a really great piece of information. So can you both describe to me, and I got a little bit of this from your presentations, did you have any moments or describe any moments where you really had to pivot? Like maybe something wasn't going right and you had to kind of redirect? And so what did you do to redirect, and how did you, or who helped you with that redirection? Madelyn?
Yeah. So one of the biggest redirections we had was once we set up the strategic plan, I developed the volunteer handbook and orientation, and we're ready to start recruiting people. We kind of realized that the health district already had volunteer onboarding processes that were outdated. And so we had to basically go back and redo everything that we thought was already set up to incorporate the MRC into it. And so that kind of pushed our recruitment back a few months, but we're starting it now, and it's been going good. I've been having good conversations with people, so we're still getting it done, but yeah.
And did you feel like during that moment where you realized that, uh-oh, we've got to redo this, were people resistant to that, or were they excited about getting it to match?
No, they were excited. I work with a really good group of people, and so they were the ones that brought it to my attention. We're like, hey, we actually need to go back and redo this. And they had been at the health district longer than I have, and they were actually the ones that created the original documents for volunteer rules and applying to be a volunteer. So they were really helpful in fixing that.
That's fantastic, because sometimes folks are not as open to change as maybe things need to be. So I'm glad to hear that wasn't the case for you, and that they were helpful, that they brought it to you and said, okay, let's get this done. It's kind of the best scenario possible for a pivot.
Yeah, and their mentality in that too is like, we don't want to have to find another error a year from now and go back and fix it. So we just want to fix it now and make sure that it's good.
That's lovely. And that you had the time and space to do that, I think, was fantastic too. What about you, Brianne? Did you have any moments where you had to kind of pivot and retool what you were doing?
Yeah, so the Step Up program is only 10 weeks, and my research project is pretty intensive. A lot of like data analysis, a lot of large data sets we had to use. So, towards the end, when I was finalizing making all of my maps, um, the ozone data set was my largest data set to use. And so my RStudio on my computer was like not working with it. It would like crash every time. And so it was taking like a lot longer for me to finish that one. So by the end of the program, when we were doing our presentation, I didn't have that one in, but I did speak about it. But Dr. Chris Lim, who was my preceptor and also my mentor for the program itself, we kind of used he has like a VPN that a lot of like faculty members have on campus. And so I was able to get onto his VPN and start a map with it, but I never was able to finalize it and have it in my presentation. So we kind of just went around the ozone one, but we had PM 2.5 in there. So it kind of like balanced out. We were still talking about air pollution at the end of the day.
Yeah, what I loved about learning about your particular project is that you use publicly available data sets. And I was like, oh my gosh, the things that we don't think, I mean, I think at some level we know someone's collecting data about it because we hear about some, but we don't realize it's data any of us could go and look at and access. And not that all of us would know how to do anything with it, mind you, but we could, right? And so I thought that was really an interesting point for your project, which made sense for an established internship program you're not using private data, you're using something that's out there. It's really cool. So can you both talk about, because I think this is a really important piece of the applied practice experience that isn't always as obvious when students are presenting on it, but can you talk a little bit about how you networked during your experience and what that was like for you?
Yes.
Yeah.
Go ahead, Brianne.
So with the Step Up program, they did different like functions where we were able to talk with other students' mentors. So I was able to meet with not only like Dr. Chris Lim, but I was able to meet other faculty from different parts of campus. So there was like a mentor that was in the biology department, and then we had some specifically in the cancer center. There was a mentor that was from the nursing department. So I was able to talk with them and kind of ask like, you know, how did you get to where you are doing like cancer research, and what were the steps that you took to get there? And then also the program, for those of us that applied, it was from like many different universities. So we had students from UCLA, there was some from ASU, we had some from USC. So I was able to like connect with them on LinkedIn, and I get to see like what they're doing and any opportunities that they share on their like social media platforms that are still like available to me, even though like I'm in Arizona and they're either in like California or Phoenix. So it was nice to be able to talk with not only a bunch of different other faculty, but meet with other students who are also involved in like health sciences, and to see what they want to do with their career and what they have background wise, and just advice that we would give to one another.
That's really cool. I did not realize it was a cross like university program. That's fantastic because I think you're right. There's the networking with faculty pieces, which is incredibly important for your career, but networking with people from other places who might have totally different opportunities is another layer, even if they're your peers, right? Is another layer of networking we don't often think about. We think about professional networking as like us and up, but that collegial networking is really important too, because those folks are going to go on to careers that may have connect to you and have interest and value for you as well. That's really great. Madelyn, can you share a little bit?
Yes. So starting this MRC unit from the ground up would have been impossible without networking. There are a ton of resources online for how to run and set up the MRC, and the people that put those resources out are incredibly willing and able to meet with you and talk to you and give you more advice on how to operate that process. And also locally, I mean, it helps being in a rural area because everybody kind of knows each other, but my preceptor was really good about connecting me with the county emergency preparedness directors, other MRCs in the state of Washington, our regional coordinator in Region 10, which is Washington, Idaho, Alaska, and Oregon, the search and rescue teams here, our CERT teams, which is community emergency response teams. So it was a big collaborative effort to get this set up. Also, again, that conference in Chicago, if you had mapped out like where the MRCs were in the United States, most of them are on the East Coast. So I got to meet a lot of people from Virginia and DC over there, and see how they've been operating their MRCs, which have been up for 20 plus years. So yeah, it was a lot of networking, which was good.
Yeah, that is really great, but further than I expected you to say, right? So I didn't, the conference piece I think is really critical. And I know you mentioned that there are, I think you said 800 MRCs nationwide, somewhere around there, which is a lot of networking possibilities as well, right? But as you mentioned, being in a rural area, sometimes you already know everybody. So how are you going to expand that network? And it sounds like you did a great job and had a great preceptor, which is a cornerstone to these projects, right? Somebody who's willing and able to help position you.
Yes, yeah, and two more pieces on that. With the rural area, there's a lot of already formed relationships and kind of grievances with people. So coming into this, I'm not from here, so moving here and having no rapport with anybody is kind of an advantage because it's a blank slate and you can form new relationships. And also I wanted to give a shout out to Maricopa County's MRC. That's where I grew up, and their MRC is really on top of it. They are, yeah, they're really good. I get a lot of resources from them.
Yeah, that's awesome. I don't know if anybody's here from Maricopa today, but I will pass that along so that should they need to know that. That's great. So for both of you, how do you think your applied practice experience is going to help you on your career path? Whether that's like, this is what I'm going to do, or this is what I'm not going to do, or somewhere in between. How do you think it's going to help you? Brianne?
Yeah, so with epidemiology, like through my experience as an MPH student in the epi department, I've realized like how much data analysis ties in to epidemiology. You would think it's more like what biostatisticians do, but it's also open a lot for epidemiologists as well. So with my internship, I was able to learn a lot about data analysis, and I feel like I have like that very good experience that's needed, especially doing a current job search. A lot of it is based off of like how much experience you have and what you're able to know to do. So with the Step Up program, it not only gave me the data analysis, it also gave me like presentation experience, collaborative efforts. I was able to do community outreach and education, which all ties into public health together and also with my field of epidemiology. So when I'm like applying to jobs now, I'm able to incorporate not only like the Step Up program, but now I've been able to work under Dr. Chris Lim, continuing on our current project from this past summer. So I get to include what we did over the summer and now what we've been doing over this past semester into my resume and into like job applications, which are hopefully giving me a better chance at obtaining these jobs and these career paths. And I've always wanted to be involved with cancer prevention and control. So having this background, I was able to network with other like mentors who have this background, and I can reach out to them and just say, hey, I was part of the Step Up program, and I know who your mentee was, and I'm just reaching out to see if you have any like research projects you would like need help on or anything like that. So it gave me a lot of like the networking that I wanted as well.
Yeah, that's awesome. I think that it sounds like this is something that, you found, whether you stumbled upon it at the HSIB building or not, you found a project that sort of was built in a lot of ways for what you wanted to do. But I do think it's really important to acknowledge the piece that you said about it's not only the data analysis that makes you marketable now for the jobs, it's the community outreach, it's the networking, it's the collaboration. So it's really showing you as a well-rounded public health, practitioner, and not just like, I can do data analysis, but I don't know how to talk to community. Like you can bridge that gap, which I think is something underestimated for epidemiologists, right? You have to be able to do both in some ways. And so I think that's really an important piece for you, for sure. So that's great. Madelyn, what about you? I know you mentioned you work full time and that this was the project. So what does this look like for you in terms of career path?
Well, I want to emphasize what Brianne said about just getting the experience on your resume. It's really hard to get your foot in the door. And so having that internship experience has been really great. For me, it's really opened the door to a whole different career path, like the path of emergency preparedness. I had never considered it, and now I have all of this experience in it. So that's been really interesting and, can take me many different ways. But for health services administration specifically, also gaining that experience in project management and volunteer management. Those are two really important skills that I'm excited to put on my resume. And also working in a rural area forces you to get very creative in how you address things. So I'll just leave it at that.
Yeah, you've done a great job today so far in being very positive with your language. I'm loving it. Creative or grievances. Maybe I'm reading into the undertones, but I hear what you're saying, and I think that it's really important that and you mentioned it in your presentation, when communities are under-resourced, you have to be creative, and that community might be the county health department. And it might be the people who the county health department are serving. It can be both things. And you have to be doubly creative when that's the situation. So I love hearing that this kind of opened a new door for you. So Brianne, it was sort of kept her on her path. And for you, it's given you this kind of public health branch of emergency preparedness that maybe you hadn't thought about before. And I think it also, both of you, it really showcases how incredibly diverse the field of public health is, right? Like you both are talking about totally different things, and yet you're both in the same MPH program and doing very different experiences. And I think that is when people often say, what is public health? What you're doing a master's degree, what does that mean? I used to get questions like that. I'm sure people still do. And you're able to say, well, it can mean 8,000 things, and this is what it means for me. And I think that's really good that both of you have kind of, seems like you fine-tuned that a little bit for yourself. So that's excellent. Okay, here's a different type of question. Would you have done anything differently for your experiences? Whether that's maybe an activity or an objective, or how you found it, or would you've done anything differently? And that might be a no, or you might have an example. Madelyn, why don't we start with you?
I don't know if I would have. Maybe go back and anticipate all the things I couldn't anticipate before, but no, I think everything played out how I mostly planned it to, or how I would have hoped it would have. So
I love that. I love that answer. That's fantastic. Brianne, what about you? Anything you would have done differently?
No, I'm the same. There's nothing I would have done differently. I really enjoyed the program itself. I feel like I did kind of go in with just like baseline knowledge of what the Step Up program was, and then I was able to learn more about what I was doing with Dr. Chrislam when we were doing like our paperwork for the APE, but like actually doing the work and talking about it, I was like I had no idea I'd be doing any of this.
Yeah.
So it was just like really exciting to be able to learn all these new things and have that opportunity.
Yeah, it seems to me like both of you also just went in with really open minds. Like, even though you have to do the planning for the APE, we ask you to give very detailed objectives and activities and kind of tell us what you're going to do. But there's still that element of openness when you go in with it to say, okay, this is what I think is going to happen, but let me be open to what might happen. That I think usually when we do that, we get to the end of an experience and we feel pretty positive about it, even if there were hurdles to jump or challenges or data sets that are too big and volunteer documents that are not right. So we're able to sort of pivot and deal with those things in a more positive way. It's really great to hear. I have a few more questions for you, and then we will open it to the audience. Audience, if you have questions already that are just burning for you, please feel free to pop those into the chat and we'll make sure to get to them. Otherwise, hang tight for a few more minutes and we'll open it up. So next question, I think is just a really fun one, but what was your favorite part about your experience? Favorite thing that you did? Anything, favorite part?
I'll go first. My favorite part was, well, besides the interesting people that I got to meet, expanding my own personal preparedness. So making that go bag and a home safety plan. We've talked a lot about prolonged field care. So if I'm on a hike with a friend and they get injured, I kind of know what to do in that situation now, when we're waiting for people to come and help. So just feeling more personally prepared and confident that I can manage my own safety and safety of the people around me.
That's fantastic. Yeah, my husband is a firefighter, so we have backpacks a lot that are filled with things that I think have thought were ridiculous that now, Madelyn, I'm starting to realize maybe are less so. Maybe are helpful to have. All the rope, I'm not sure why, but you never know. Brianne, what about you? Favorite part?
I think my favorite part was my research project and the topic itself specifically. It was pretty different from all the other step-up students in the program. It discussed cancer, but it more so was talking about environmental exposures and how past historical racist language has still lingering effects to this day, which is really important, especially when we're tackling health disparities and different health inequities that are going on. So I was really excited to be able to do that research and create my plots and maps to show how this still is impacting people to this day. And then also doing my presentation at the end and sharing my research and my results of that. I got a really good feedback of how my presentation went. And so it felt like that was like a pat on the back for myself.
Yeah, I'm certain it was. I'm certain it was. Your presentation had me, I have this document of things to learn more about, and I had the covenants on there because it's something I feel like I've heard about, but not really delved into. And I found myself really thinking about where I live, and I know there were redlining areas and things like that, and so really wanting to dive into the history of that. And that it isn't something that just happened in the past. It's something that continues to happen, and in bigger ways than we ever could have imagined. So yeah, your project really had a couple of points for me. I was like, oh, I need to know more about this. And I just thought that was really cool, right? You're in this Step Up Cancer Research Program, but you're really doing disparities work and health inequities work, and in a very quantitative way. Which is something we don't always see either. So that was really interesting. So I have two more questions. This next one is, what do you feel like you learned about yourself during the experience? So how you work, things you think or know or believe, not about the tasks, but about yourself.
I learned not to underestimate myself. I feel like especially with going into the career field, getting this master's and now doing applying to jobs and stuff. I just realized the program taught me you can do anything, especially in a short amount of time. Learning a completely new software was something that I never thought. I also feel like I was really bad with biostatistics and that sort of stuff. So it taught me not to ever underestimate myself and what I can do, regardless of whether it's a specific task or the amount of time frame that's in. That was my biggest learning experience.
We can do hard things. You can do hard things, and you did it, right? And that feels really good, I bet, to realize that you can do really hard things in a short amount of time. Madelyn, what about you?
I really like Brianne's answer and I kind of want to steal it. So same. Yeah, like the beginning of this progress or process, it seems very daunting of taking on this whole project, and then you just kind of start chipping away at it and do one little thing at a time, and then eventually it's a year later and you look back and it's like, oh, I did that and I'm very capable of doing that and doing it again. So yeah.
And taking that confidence with you in job applications and on job interviews. I can do hard things. I think that that's a really important thing to embrace and embody as you go into these next steps too. And as a reminder for students in the audience who are maybe just starting to plan their experiences or who are in the middle of them and maybe having some challenges, you can do hard things and don't underestimate yourself. Don't underestimate the type of project you can execute, because it can be really amazing. I think that's great information. So my last question, and then we'll open it to the audience, is what is some parting advice you would give to MPH students who are looking for their experiences, doing their experiences, or prospective students? So if you're talking to a new MPH student, what's some parting advice you would give them?
Two things. I would say, I mean, obviously look for something that you're interested in and aligns with your career goals, but also if there's an opportunity that comes up that is not exactly what you were thinking of or anticipating, and it's a little bit outside of your comfort zone, it might be a really good learning experience for you. And like it did for me, like open a lot of doors. So I would say be open-minded. And also, as much as you can plan, anticipate setbacks and maybe give some buffer space just in case something doesn't go how you planned it.
I love that. Grace in the timeline is always helpful. But yeah, I really like that advice of, look for what you're interested in, but don't close the door to everything else, because it might be just what you were looking for. Brianne.
I recommend apply to multiple things, not just one. Like, don't kind of put all your eggs in one basket. If you're kind of like really wanting an intern, like a specific one, just make sure you have backup plans, because sometimes it'll fall through or it just won't end up going the way that you hope it does. Utilize like all over the health campus, especially HSIB. There's flyers like everywhere about so many different like research opportunities. So like the step up program was for me that I found, but also with the MPH listserv, constantly read through that. I not only found the step up program through there, but I also applied to other different internships while I was applying to that one that I saw in there, just to like have, in case it didn't like work out for me, I had other things to go through. And then also look outside the university as well, like through LinkedIn and other places. You don't have to do something specifically through the university, and there's like other different opportunities out there. And similar to what Madelyn said, like you can, like, if for me, epi, like I was searching for an epi one, but it kind of like was a whole, like public health as a whole was what like my internship I found. I did epi work, but I was learning about like different parts of public health while doing my internship. So just those.
Yeah, that's great advice. And no, I did not pay Brianne to plug and make sure you're reading the newsletters, but make sure you're reading the newsletters and checking out the hub and using your network to find opportunities, right? I was just looking in our database today, and we have students in about 40 different places, right? So the university is only one of the many, and that's just campus programs. That is not including our online MPH. I didn't get a chance to look at that section of the database before this session. So we're probably at more like 80 or 60 different locations across the country. And so, and we didn't share all of those opportunities. Students found those on their own in some cases, right? So there's different ways to do that. So I think that's some really good parting advice. So I'm going to open it to the audience for questions. See if anybody has some questions. I know some people had to jump off, and that's fine. Does anyone in the audience have questions for either Brianne, Madelyn, or both? You can use the chat, or if you prefer, you can raise your hand and unmute. I know our questions do give sort of a full spectrum, so we may have already covered things that you were interested in. Okay, well, thank you so much, Brianne and Madelyn. We so appreciate you. I will say to everybody watching still. If you have questions for Brianne or Madelyn, their emails are in the abstract presentation booklet, which is on the website. So if you have questions about their project, things that you want to know a little bit more after you watch their presentation, you're welcome to contact them. I chatted with them both about that before I said it. So you're welcome to contact them and ask them some other questions. But I'm going to pass it to Mariah.
Yes, so thank you everybody for attending today. Thank you to Kim and our presenters for this discussion. First, I would like to thank all of our wonderful applied practice experience sites throughout the state, nation, and world with whom we work to improve the state of public health. The Applied Practice Experience Conference serves as a professional opportunity for our Master of Public Health students to share their applied practice experiences, and it's what has been one of the most impactful and practical components of the program's curriculum. Since its establishment, the MPH Applied Practice Experience Conference has grown in stature and significance, and the college uses this event as a public health networking tool by inviting public health practitioners, partners, and alumni through the state. The key to its success lies in the student participation in this panel and the exceptional student presenters. So through contributions they've made and the benefits they've gained, the Applied Practice Experience Conference reflects the indelible handprint of MESCOT students on public health projects and agencies throughout the world. We sincerely thank you for coming to our virtual MPH Applied Practice Experience Student Highlight event. For anyone viewing the recording of this in the future, hello and thank you for watching. And then I'm going to be putting a link in the chat to our feedback form. We would appreciate it if everyone who attended could take a few minutes to complete that form to help us make this event better. Each time we do it fall, spring, and summer, and we're constantly interested in quality improvement as a School of Public Health. So I'll pass it to Vanessa.
Thank you, Mariah. So the virtual experience allows us to provide an applied practice experience conference that showcases projects from students across all of our campuses. Each student has recorded themselves presenting on their master's applied practice experience. These presentation recordings are being hosted on a webpage on the College of Public Health website. This page went live earlier today, and you can now access our presenters' recordings. So we're going to go ahead and put that link in the chat, and then there'll be a feedback form as well. We have also sent this website link to our College of Public Health community, as well as individually to all presenters for them to share with family, friends, site preceptors, and anyone else they would like to share it with. Presentations will be viewable in an on-demand format as of Monday, until May 3rd. At that time, the presentation viewing webpage will be deactivated. We encourage you to watch as many presentations as you are able to during the viewing period. We encourage you to watch as many as you can. For each presentation you watch, we ask that you fill out the presentation feedback form linked on the presentation viewing webpage. We appreciate your support of the College of Public Health and of our MPH students. They have all worked incredibly hard on their applied practice experience projects, and we are excited for you to view these presentations in order to see the ways in which they are helping move public health issues forward in our communities. We have now come to the end of our live event. We sincerely appreciate you all joining us this afternoon, and thank you to our students panelists. We hope you enjoy watching the student presentations and have a fantastic evening.
Thank you all so much. Have a great day.
Bye, everyone. Great job.